All right, so we're gonna kind of talk about dry needling from the perspective of therapist to kind of a patient or a caregiver. So dry needling is a form of treatment that utilizes very thin needles to help with pain. The most common use of dry needling involves us inserting these needles into specific spots of pain that are on the patient's body, located in like your muscles and your tissues, which we term trigger points. So for instance, have you ever felt like your shoulder and neck area is super tight and stiff? Well, have you like ever then further pushed on these muscles and noticed that whenever you push on them, it causes you a lot of pain and becomes very tender? These are what trigger points are, and they often tell us that your muscles and tissues are very tight, and this is where dry needling comes into play.
Yeah, and so when these needles, when they hit the right spot of those trigger points, you may feel as if your muscle is twitching or like jerking. And so most patients, they think this feeling isn't supposed to happen, but it's actually the exact response that you're looking for when you dry needle. This response is crucial to help loosen up the tight areas and to help the muscle realign itself back to normal. And then now in terms of like long-lasting pain, dry needling can play a big role. The pain you feel isn't just coming from a tight muscle or a tissue.
So there's actually a pathway that regulates how we process pain, which involves the spinal cord in the brain. When we experience something that's painful, it sends a signal to our brain, telling the brain, ouch, that hurt. Our bodies will respond to that signal. The great thing about dry needling is it actually works to block that pain signal. You can think of it this way. Whenever we feel pain, it's like a gate that opens up, allowing for the painful thing to send a signal to the brain, the spinal cord. But when we dry needle, that closes the gate, blocking the pain signals from communicating with our brain and spinal cord.
Thank you.